Have you ever wondered why the definition of high blood pressure keeps changing? For decades, what was once considered normal suddenly became dangerous, and millions of new patients appeared overnight. But is this progress in medicine, or a system that quietly benefits from keeping people sick? Stay until the end, because what you'll discover might completely change the way you see modern healthcare. It almost seems like coincidence, or perhaps a system. Over the past few decades, the official definition of normal blood pressure has been quietly rewritten again and again. In the 1970s, doctors started treatment only if a patient's values reached around 160/95. By the 1990s, that threshold fell to 140/90. And since 2017, new medical guidelines now label anything above 120/80 as elevated. The result? Suddenly, tens of millions of people moved overnight into the category of at risk. But here's the uncomfortable question. Are we really saving more lives, or simply creating more patients, more prescriptions, and more lifelong therapies? Looking back, a clear pattern appears. In the past, doctors focused on the severe cases. When someone had slightly elevated values, the recommendation was simple: move more, lose some weight, eat less salt. Later, the thresholds kept falling, justified by statistics showing that just a few points lower could reduce heart attacks and strokes. Yet few asked how representative those numbers truly were, or what the cost of permanent medicalization might be. Today, with each new redefinition, the circle of the sick grows larger. Millions are diagnosed with hypertension, sometimes after just one measurement at the doctor's office. But blood pressure isn't a fixed number. It fluctuates through the day, with stress, lack of sleep, a cup of coffee, or even climbing stairs before the appointment. Even posture can distort results. Crossed legs, unsupported arms, feet dangling off the floor, all of it can raise readings artificially. Still, one single situational measurement is often enough to start a therapy that may last for life. And those side effects? They rarely get the same attention as the promised benefits. The large study that fueled this global push for aggressive lowering of blood pressure showed impressive results, but mainly in high-risk patients. From that narrow data, a general rule was born for everyone. Particularly among older adults, this can be dangerous. With age, blood pressure naturally rises. It's how the body maintains circulation. Lowering it too far can lead to dizziness, fainting, kidney stress, and an increased risk of falls, ironically reducing the very quality of life that treatment was supposed to protect. Experts suggest we may have reached a point where broad prescription policies replace precise patient-centered diagnostics. A calm look at the basics reveals how much could be solved with proper, repeated measurements. At home, in a relaxed setting, with correct cuff size, arm at heart level, and feet firmly on the floor. Only then do the numbers tell the truth. At the same time, addressing root causes, healthier nutrition, regular movement, reducing stress, stabilizing sleep, changes the body in a lasting way, without the side effects of multiple drugs. It takes patience, yes, but it restores something modern medicine often forgets: self-control and personal responsibility for one's health. Because every time the normal range is lowered, the number of patients rises, and so do prescriptions, costs, and pressure on the healthcare system. Each new diagnosis means more appointments, more medications, and fewer resources for those who truly need them. Wouldn't it make more sense to invest part of that money into prevention, exercise programs, education, and nutrition awareness, instead of widening the definition of disease? In the end, blood pressure is not a sentence, it's a signal. When measured carefully and interpreted wisely, it guides us toward balance, not fear. The goal shouldn't be to treat numbers, but to strengthen people. A health system that empowers individuals instead of labeling them as patients doesn't make everyone sick. It makes them aware and capable of action. If this perspective helped you see things differently, make sure to subscribe, like, and share your thoughts in the comments. Your opinion matters, and your awareness could be the start of real change.